So good afternoon, everyone. On behalf of Department of Statistics, KC College, I, Dr. Pratiksha Kadam, welcome you all for today's international level webinar on population and sustainable development, organized on the occasion of World Population Day under the theme Azadi Ka Amrit Mahotsav. Department of Statistics was started by keeping in mind the importance of research aptitude in the dynamic world of education. Statistics, a subject which offers immense and varied employment opportunities, was first offered as a major subject at BSc level in 1958 by University of Mumbai. KC College was amongst the first few colleges of University of Mumbai to do so. The department is committed to enhance the knowledge and to promote the research. The faculties publish the research papers in noteworthy journals. They carry out the activities. We carry out the activities to enhance the knowledge of our students as well as faculty members. And our today's webinar is one of the activity of the department, which is planned to enhance the knowledge about the population and sustainability development of the participants. We have amongst us Dr. Shalini Sinha, who is Vice Principal of Students Affairs at KC College. She is the Associate Professor in the Department of English. She has diverse interests and is passionately devoted to culture, literary, and gender studies. Her special area of interest is research in Indian English fiction, inculcating communication skills in youth, and in organizing ventures that lead to women's empowerment. Dr. Sinha has published several research papers in peer-reviewed research journals and critical anthologies. She has strong faith in the power of youth in taking the nation forward, and hence believes that education has to be inclusive, incisive, and inspirational. I request Shalini ma'am to deliver the welcome address.
Thank you so much, Pratiksha. Thank you. It's a great honor and a pleasure today to welcome such an eminent personality as Dr. Ulimiri V. Somayajulu. Thank you so much, sir, for being here today with us. When Asha ma'am gave me your profile, I was quite astounded at the kind of work that you've done. And what is very, very interesting is that your profile is also so diverse. You have an MA in social sciences, sociology, and then you've gone on to do an MSc in statistics. You are now, the way up there in the field of population studies. You have so many research studies that you've done with so many world organizations. So it's really our honor to have a person with your profile with us today. And thank you, Asha madam, for having organized this webinar for our students. Luckily for us, the pandemic has shown us a way that even if people are far away, we can reach them through webinars. That's one plus point. At least, we don't have to now wait for physically, inviting people. We can at least meet in this way. And so much of knowledge gets shared. So all the audience today will be delighted to know more about Dr. Somayajulu and the kind of profile he has. He's worked with so many universities, and he has worked with almost 500 plus research projects. So, what it merely says is how learning is so important. He is not just a teacher, he's not just a researcher, he's a learner. And that is what is so important to all of us, maybe teachers, but we are first of all learners, and learning is what is so important. And this is something our students also need to understand, because learning is not something that you get by chance. Learning is something that you apply yourself to assiduously. And it is something that you do with great, diligence. And only then can you learn. So, when people like these come, to our webinars, they inspire our students, and not just students. I'm so hugely inspired by your diverse profile. So thank you so much, Dr. Somayajulu. Thank you so much, the entire Department of Statistics, for having organized this webinar under the leadership of Dr. Asha Jindal and all the others, Dr. Moole, Dr. Pratiksha Kadam, all the other members of the department. Thank you so much for having taken so much of effort to having organized this webinar. And I'm also looking forward to listening to Dr. Somayajulu. So thank you so much. Welcome each one of you. I'm sure we're going to have a very, very fruitful session in front of us. Thank you.
Thank you so much, ma'am, for your welcome address. Now we are blessed to have the eminent speaker, Dr. Ulumiri Somyajulu, who is currently the CEO and Executive Director of Sigma Research and Consulting, New Delhi, India, and also the President of Sigma Training and Applied Research Foundation. He is also the President of Indian Association for Study of Population, IASP, Vice President of Indian Association for Social Sciences and Health, IASSH, and the Vice President of Andhra University Statistics Department, Alumni Association. Dr. Somyajulu is visiting faculty for Delhi University, JNU, Nagarjuna University, Terry University, IGNU, Dr. Ambedkar Open University, Aliyah University, Jamia Mila Islamia, TISS, Utkal University, IIHMR University, Devonshire University, Andhra University, and many more. He has done MSc in Statistics with specialization in Demography, SQC and Advanced Operation Research from Andhra University, MPhil and PhD in Population Studies from International Institute for Population Sciences, Bombay, MA in Sociology from Annamalai University, and PG Diploma in Management. Sir has also done PG Diploma in Human Research Management and MBA in Specialization HRM from IGNU University. Dr. Somyajulu is the author of 9 edited books and 120 papers in demography, rural development education, CSR, health, aging, nutrition, family welfare, HIV or AIDS, etc. He has published in national journals, edited books, and presented at national and international conferences and seminars. He visited 29 countries, including USA, UK, Belgium, Australia, and many more for paper presentation and invited talks. Dr. Somyajulu has also coordinated more than 500 research studies or research projects for UNICEF, World Bank, UNFPA, UNESCO, UNDP, British Council Division, DFID, and many more. I request Sir to deliver his address. We all are eagerly waiting for your address, sir. Thank you so much for accepting our invitation. Over to you, sir.
Namaskar. I am thankful to all of you. Respected Dr. Asha Jindalji, Dr. Shalini Sinhaji, Dr. Pratiksha Kadamji, and all the faculty members of the Statistics Department, faculty from other departments of the KC College, and the students, and all other friends. It's really great, pleasure to be with you all this afternoon, and with the kind of words used by Dr. Shalini ji and Dr. Pratiksha ji. Really, I am getting little, concerned, because your expectations are so high. Whether I will be able to meet your expectations or not, that's the challenge before me. But let me take the challenge in a positive way. And as Dr. Shalini ji rightly mentioned, I don't consider myself as an expert or somebody who has achieved already what is to be achieved. I am still learning, because we are all statisticians. Learning is a continuous variable, and it has only commas, but there is no full stop for learning. That is my honest and humble view and submission to all of you. So without wasting much time, by thanking you all for giving me this opportunity to be with you, and also many of you have joined this webinar. Yes, COVID has taught us that we can get connected, we can continue our activities towards dissemination of knowledge and absorbing knowledge using virtual platforms like this. And I think that is blessing in disguise. So let me take you through the brief presentation I have prepared on the occasion of the World Population Day, which is observed today on 11th July. Are you able to see my screen, PPT? Yeah. See, today I will be talking about population and sustainable development. As part of the webinar organized by the KC College on the occasion of World Population Day. This is the outline of my presentation. I will talk about the World Population Day. Then I will talk about the World Population Day theme. And then I will move to the Sustainable Development Agenda 2030. Then I think Dr. Pratiksha ji mentioned about Azadi Ka Amrit Mahotsav. So let us also have a look at the kind of initiatives from the Government of India towards the Sustainable Development Agenda achievement. Then I will present few slides about the status of achievement with regard to the Sustainable Development Goals for the country as a whole. Then, because you are all from Mumbai, Maharashtra, I will give you few indicators for the state of Maharashtra. This is a quote from late Sri Atal Bihari Vajpayee ji, former Prime Minister. He said that, I quote, population needs to be stabilized for sustainable development. That means Sri Vajpayee ji has highlighted the importance of population stabilization if we want to achieve sustainable development for the country as a whole. Let us understand the context for the World Population Day. In 1989, the Governing Council of United Nations, it recommended that 11th July be observed as the World Population Day by the international community. In fact, in 1987, the world population reached 5 billion. That was the year when I moved to Mumbai. I got my admission into MPhil PhD program of IAPS. 1987 July, I came there, and that was the year, that was the occasion, the world population crossed 5 billion. The idea of observing the World Population Day, it's not a celebration, but it is observing. मनाता है, मनाते हैं हम World Population Day, हिंदी में बोलना. Because the idea is to have some focused attention on the urgency and importance of the population and related issues, and various governments are expected to come out with policy and program initiatives to address the issues that are related to population and population related challenges. They are not problems, but they are challenges and they are opportunities. I think every problem should be looked in as an opportunity, as a challenge, so that the strategies can be implemented to come over the problem. The United Nations gives various themes for every year when we are observing the World Population Day. For example, in 1996, reproductive health and HIV/AIDS was the theme. That time, many countries, including India, they were having these HIV/AIDS related challenges. Then we moved to, in 1998, we were reaching 6 billion, so the theme was approaching the 6 billion. And in 2000, it was about saving women's lives. As you know, many countries, including India, have very high levels of maternal mortality. When we say maternal mortality, we are talking about the women who will be dying during pregnancy or during the delivery or immediately after the first few days or weeks of the delivery due to complications in the delivery. So the idea was to have some strategies to address the issue of maternal mortality, and so that we will be able to save the lives of the women. Like that, it continued. And then in 2004, the theme was ICPD at 10, International Conference on Population and Development, that was held in 1994 at Cairo. As a follow-up of that, the theme was ICPD at 10. And similarly, in 2019, fighting poverty and educating girls was the theme. And it continued 2011. It was 7 billion actions because the population was reaching 7 billion. And it continued like that. And 2019, the theme was 25 plus years of ICPD. 2020 was about the COVID, about the health and rights of the women and girls. And then 2021, it was about the rights and choices. And now we are in 2022. Today is the World Population Day. The theme for this year is that a world of 8 billion towards resilient future for all, harnessing opportunities and ensuring rights and choices for all. This is the broad theme for 2022. So it is talking about a resilient future for all. That means sustainable development. We should not enjoy our today at the cost of tomorrow of our children. That should be the motto. And we should think about our children's tomorrow. We should think about the life of our children, our grandchildren, and we should leave the planet in a livable condition so that our children and grandchildren will not have any problem.
बड़े सर यहीं बैठ रहे हो?
Our children and grandchildren will not have any challenges to face because of our improper actions today. And similarly, what kind of opportunities are there for everybody, irrespective of country they live in, irrespective of region, irrespective of religion, irrespective of caste, irrespective of gender, irrespective of age, everything. Everybody should have rights and their rights should be protected. And then everyone should have choices for them, whether it is in terms of education or livelihood or marriage or family size, whatever it is, living style, lifestyle, whatever it is, where to live, how to live. I think that's the individual's choice. So this is the theme for 2022. Now, just one slide on the population trends. Some of you may be familiar, some of you may not be so familiar. This is for the country India. In 1955, this is taken from the World Bank report. In 1955, we had about 40 crores, 41 crores. And in 2021, because we have the decadal census, the census is carried out every 10 years. It started in 1871 and the last census was held in 2011, and the census was supposed to be held in 2021, but because of the pandemic COVID, it could not be taken up. It is delayed. Now it will be taken up anytime now. So in 2021, the estimate was 139 crores, and there are also projections available. By 2030, India is expected to have about 150 crore population, and by 2050, it is expected to reach about 163 crores. Huge population. Look at 1955, we are just 40 crores. By 2050 means almost 95 years. We will be almost 4 times to that. 40 into 4, 160. We will be having 4 times bigger population compared to 1955. When we got independence, we were 30 crores. And if you look at the urban population, that is another dimension, the urbanization, increase in the urban population. In 1965, 18% was urban population. And by 2021, almost 1/3, or rather more than 1/3 of the population in India was in urban areas. All of you are from Mumbai. You know the urban life in Mumbai, the local trains, how crowded they are, how difficult it is, how easy it is to get into the train, how difficult it is to get out of the train. I lived in Bombay from 1987 to 1990. I think compared to that period, this period, it has become much. After 839, the Harbour Lane trains from Govandi to VT, that time it was VT, now it is CST, on the Harbour Line, they used to be empty almost. In the railway coach, only handful of people used to be there after 8:39 in the night if you are traveling from Govandi to VT station. But now I don't find so. You know, anytime you travel, even in the Harbour Line, not only Central Line and Western Line, even in the Harbour Line, anytime you go, you see people. So that's the kind of, nowadays when I go to Bombay, I prefer to travel by first class rather than the second class, because even in first class, it is difficult to get into the train and come out of the train. That is the kind of challenge urbanization is posing. And look at the slum areas in Bombay, Dharavi, Asia's largest slum, and their living conditions and all. Urbanization has its own problems, its own challenges and all. We are all aware of that. And by 2050, almost, half of the population of India is expected to be in the urban areas. So some of it will be migration from rural area to urban areas, and some of it will be urban population itself. But bulk of it will be the migration from rural areas to urban areas. And if you look at the urbanization trends in India, the movement is from small towns to the big towns. And most of the times, the migration takes place to the bigger towns, metropolitans, well, at Bombay, Bangalore, Delhi, Kolkata, like that, Hyderabad, like that, and not much to the tier 2, tier 3 towns. So this is the kind of situation in terms of urbanization. Just one interesting statistics is that the UP's population is almost equal to Brazil, and Maharashtra's population is almost equal to that of Mexico. Bihar has a Germany in it. That's like that. If you are talking about European Union, you have Brazil, you have Mexico, you have Germany, Europe, you have UK, you have Spain. So many countries are there. Portugal, Poland, etc. Many countries are there. But many of the European countries are as big as some of our states in terms of population, like Brazil and UP, Mexico and Maharashtra, Germany and Bihar. This is just an example. And if you look at the age structure of Indian population, more than 50% of the population is below 25 years, and 65% of the population is below 35 years. Here comes the issue of the demographic dividend. When you are talking about demographic dividend is the availability of the youth population in the country. As a result of the availability of youth population in the country, you can get the benefit of the availability of youth. When we are saying that we can get the benefit of the availability of youth population, Honorable Prime Minister also made a mention of that. When you are talking about that, we are talking about the skilled youth. The youth have to be skilled. They should have the skills that are required so that they can get into the employment market, whether it is through public sector employment or private sector, or whether it will be through startup as per the initiative of the government of India, whatever is that. So that is one challenge for us, to ensure that all the youth we have are skilled so that they meet the demand that is from the employment market. In terms of the skill they are expected to have. Now, having looked at the population statistics very briefly, let me now move to the Sustainable Development Agenda. In September 2015, the General Assembly of the United Nations adopted the 2030 Agenda for Sustainable Development. This agenda includes 17 Sustainable Development Goals. And the idea behind this agenda is that to build on the principle of leaving no one behind. No one should be left out. Everybody should be with us. I think in line with that, the Honorable Prime Minister also said that Sabke Saath, Sabke Vikas. I think we should move with everybody, and we should ensure that everybody is on the path of development. Nobody is left out when we are talking about the development of the society and the country or the nation. Let us look into the goals of the Sustainable Development Agenda. The goal number 1 is about the ending poverty in all forms everywhere. If you are talking about the countries, no country should have poverty. And if you are talking about a country, no place, no village, no urban ward, no slum should have poverty. So everybody should be free from poverty. The goal number 2 pertains to zero hunger. Here, ending hunger and achieving food security and improved nutrition and promoting sustainable agriculture. These are the issues involved here. The next goal talks about good health and well-being, ensuring healthy lives and promoting well-being of all at all ages, irrespective of age. And the next one is about ensuring inclusive and equitable quality education. And the idea is also to promote lifelong learning opportunities for all. If somebody wants to learn something, even after getting into employment, opportunities should be open for him or her. The next goal is about gender equality. I think Dr. Salini I think was also specialized in gender studies and all. So it may be of interest for her. Achieving gender equality. There should not be any discrimination on the basis of gender. And there should not be any equity issues on the basis of gender. And it also should have empowered women and girls. The next one is about making sustainable, making available clean water and sanitation, and also sustainable management for all. The next goal is about affordable and clean energy. The energy should be affordable and reliable. The initiatives from the government in terms of making Ujjwala scheme and all, making available LPG and the remote areas to the poor families. This is the idea behind that. The next one is about decent work and economic growth, followed by industry, innovation and infrastructure, followed by reduced inequality within the countries, among the countries. Next one is about sustainable cities and communities. Here we have to make our cities and human settlements inclusive, and they should be safe, and they should be sustainable. Next goal is about responsible consumption and production, followed by climate action and to combat climate change and its impact. There are research studies that indicate that climate change is going to affect or is already affecting in some countries the agriculture production. And if the agriculture production is affected, it will lead to severe impact on the consumption at the consumer level. And every one of us would be affected by that. And then we have the goal related to life below the water, followed by life on the land, managing forests, combating desertification, and land degradation has to be addressed. Biodiversity loss has to be addressed. These are all in the interest of the mankind, the interest of this human society. Followed by peace and justice, strong institutions, and these institutions should be effective, accountable, and they should have inclusiveness. I think the bottom line is that to have inclusiveness, no one should be excluded. Followed by the partnerships to achieve the goal. Here, the idea is to strengthen the means of implementation and revitalizing the global partnerships so that we move towards sustainable development. Now, let us look into some of the initiatives, because we are all researchers, we are all academicians. We should always think that our research and our contribution should be in terms of policy making and program making. And we should give inputs to the policy makers and program managers so that they get an idea about the kind of initiatives that are taken, the kind of impact these initiatives are giving us, and what else has to be done. I think that should be the motto of any kind of research or any kind of paper or article rather. So if you look at our Indian government's initiatives, I am not a spokesperson of the government of India or the ruling party or somebody like that, but I'm a statistician, I'm a social scientist. So I'm putting my perspective before you. And we can see a kind of a convergence with the national development agenda. Sabka Saath, Sabka Vikas. It's a collective effort for inclusive growth. And let us look at Sashakt Bharat and Sabal Bharat. It was about empowering the communities and making the community resilient. And the statistics available with us, the World Bank reports and other reports indicate that 271 million people were brought out from the multidimensional poverty through the economic growth and empowerment related initiatives. This is an important achievement. However, there is a long way to go. It is not that we have reached the target and we have achieved the goals. Long way to go, but this is the kind of progress we have made so far. And there are also efforts to enhance the access to nutrition, Poshan Abhiyan, and towards making India free from malnutrition, Kuposhan Mukt Bharat, and child health. There are several initiatives to improve the child health and child survival and to improve the child immunization program and all, followed by education programs. And we have Swachh Bharat and all, Swachh Bharat at the household level, Swachh Bharat at the school level, as part of the sanitation initiative, and then the drinking water, electricity and housing. Several schemes are there to provide decent housing, patta houses to the poor people in the country, wherever they are living. And let us examine the impact of all these initiatives in terms of reducing the inequalities, especially among the people who are from the vulnerable sections of the population, tribal people, scheduled caste people, some of the minority communities, people in the remote areas like northeastern states, Jammu Kashmir, like that, and where accessibility is still an issue in some of the locations. Then we have another initiative, Swachh Bharat, Swasth Bharat, and Clean and Healthy India. It is also a nationwide initiative through Clean India campaign, and we have National Nutrition Mission. And now we got almost 100% rural sanitation has been achieved. And there is some reduction in the stunting and child and maternal mortality rate, though the reduction is not as per the expectations. There are, still gaps. There are still goals to be achieved, but there has been some reduction in that. And we also have another initiative, the universal health coverage, and which is institutionalized through the Ayushman Bharat. The Ayushman Bharat is very ambitious program. It is world's largest health protection scheme because it provides annual cover of about 7,000 to 100 million family, $7,000 US dollars to 100 million families, and there are about 500 million individuals are to be covered in that. So what is the progress we have made so far in terms of reaching out to these families, needy people? To what extent we have reached, to what extent we have made impact, to what extent we have improved their lives in terms of health services and health status. I think these are all the issues to be taken up as part of the research agenda. Then we have Samagra Bharat, Saksham Bharat. This is inclusive and entrepreneurial India. Here, the idea is to have social inclusion. Whatever exclusion used to take place so far, it should be put to an end. And this is to be achieved through access to nutrition, health, education, and social protection. And it also has initiatives to develop the capabilities for entrepreneurship and employment, startups and all. Several initiatives are Skill India and skill development and all. Then another dimension is the financial inclusion through Jan Dhan, Aadhaar, and mobile. This trinity, 3 factors. And the idea is to have universal access to bank accounts through Jan Dhan Yojana. It is a financial inclusion initiative. And then the Aadhaar card, national unique identity number, and access to mobile phones. By having these 3 connectivities between these 3, there are some studies. We have done a study for the World Bank about some of the initiatives related to this, and the study indications are very encouraging. And I visited Washington DC, and I had a meeting with the World Bank group there, development group, and they were quite impressed with the findings of the study. They said we need more evidence for such kind of good practices in India. I think there are the indications from the research studies carried out so far are very encouraging. And we also have the direct benefit transfers to poor. And the idea is to include about 200 million women so that their economic empowerment can be taken care of. And then the next one is the sustainable India. This is related to the climate action strategies and electrification of the 100% of villages, is one step in the direction. And the studies also indicate that there is a reduction of 38 million tons of the CO2 emissions annually. And clean cooking fuel was made available to about 80 million poor households. And there are also initiatives to install 450 GW of renewable energy, and degradation of the land taken place, and there are also efforts to restore the degraded land. If you look at the global statistics, India stands third in terms of renewable power, and India stands fourth in the wind power and fifth in the solar power. And India also has launched Coalition for Disaster Resilient Infrastructure and International Solar Alliance. The idea is to leverage global partnerships so that climate action and disaster resilience are taken care of. Then next one is about the Sampanna Bharat and Samruddh Bharat, prosperous and vibrant India. India is one of the fastest growing and emerging market economies with a young population, and the GDP of 2.72 trillion US dollars in 2018-19, and our idea is to have 5 trillion economy by 2025. In the next 3 years, we want to reach 5 trillion economy, and this will be done through an inclusive and sustainable growth trajectory. And the idea is to stimulate the manufacturing, building infrastructure, and investments, and fostering technological innovation, and boosting the entrepreneurship. Now, we looked into the population scenario, we looked into the sustainable development agenda and sustainable development goals, we looked into the various initiatives that are there from the government of India. Now, let us look into the achievement status of the SDGs in India. This is based on the Niti Aayog's exercise. Niti Aayog has developed a methodology to track the progress of the SDGs in India, and I think similar kind of approaches should be adopted by statisticians and demographers and social scientists to track the states and even the districts in terms of achievement of the SDGs. Now, as for the first goal, no poverty, significant challenges still remain. We are able to make only moderate improvement, and the efforts are not so sufficient to attain the goal. The second one, 0-100, still there are challenges to achieve this, and the score is stagnating or increasing at less than 50% of the required rate. The health and well-being related goal, still again major challenges remain. We have looked into this. We have seen that during the COVID situation, unfortunate situation, and we were struggling. People were struggling to get admitted into hospitals, getting oxygen and all, and the infrastructure lacunae were visible during the COVID period. Unfortunate situation. And then the fourth one, again, there are challenges to address. Then the fifth one, the score is stagnating or increasing at less than 50%. The sixth one, clean water and sanitation. There is moderate improvement in the last 7-8 years, 2015 to 2022. It is almost half a mark. 2015, the Sustainable Development Agenda initiative started. Now we are in 2022, and we are left with 8 years. By 2030, we are expected to achieve the Sustainable Development Goals. But unfortunately, the COVID has its own impact on the progress we are making towards the Sustainable Development Agenda. But somebody has to document that. Some statistical models can be developed to assess the impact of COVID on our efforts, on our ability to reach the sustainable development goals. To what extent we are lagging behind because of the COVID. That is a research agenda for the end statisticians. Then the 7th goal, again, we are making only moderate improvement and insufficient to attain the goal. Same is the case with the goal number 8, goal number 9, goal number 10. Goal number 9, again, moderate improvement. Goal number 10, challenges remain, and the information is not available. That is the issue. I think this is the opportunity of window for the demographers, for the statisticians. We have to ensure that we have accurate and reliable data, good quality data, to track the progress of the various indicators at various levels. I think this is one research agenda for us. Then 11th goal, the score decreasing and major challenges remain. And goal 12, we are able to achieve this. We are on the track and we are maintaining the SDG achievement. Goal number 13, we have achieved the goal as on today. We are on track and we have to continue the efforts. We have to maintain the achievement. Else, if we become complacent, we may again lose the ground. So we have to be very cautious. Goal number 14, again the score is stagnating or increasing at less than 50% of the required rate. And goal number 15, same case. Goal number 16, same. And goal number 17 also, same kind of situation is there. Now, you are all from Maharashtra. At least you are based in Maharashtra now. You may be from different states. So I have just added 3 slides from the National Family Health Survey. The NFHS, National Family Health Survey, coordinated by IAPS, Bombay, from where I got my MPhil and PhD degree. I am in this position only because of IAPS and the training we got at IAPS almost 30 years back. And my colleague, Professor DP Singh and Dr. A.G. Khan, even Dr. Brijesh Sharma, we are all from IAPS. And NFHS is carried out by IAPS with the support from Ministry of Health and Family Welfare. And the NFHS 4th round was carried out during 2015-16. That was the year when Sustainable Development Agenda was on the list of the governments. And now the last survey was carried out during 2020-21. So the females who are 6+ years, who have ever attended a school, that percentage increased from 77% to 80% for Maharashtra, 3 percentage points. Given the, Maharashtra is one of the more developed states of the country. Mumbai or Bombay is the commercial capital of the country. Given that, I think the progress is not so encouraging. Similarly, children whose birth weight was registered, very good progress, 95 to 97%. That means 97% of the children born in Maharashtra who are below 5 years, their births are getting registered. Birth registration is an important event so that all the child immunization program and the child nutrition program, all these things are related to birth registration, and it's a good indication. And then population living with electrified households, it is almost 99% in urban areas and 98% in the rural areas of Maharashtra. Very good progress. And similarly, in case of drinking water, urban areas are good, 99%, but rural areas are 89%. So there is a gap of about 11%. And it should become 100%. And then in terms of sanitation facility, improvement from 52 to 72%. And clean fuel, good improvement from 60% to 80%. So I have told you we discussed about the sustainable development goals. We discussed about some of the initiatives. We talked about the tracking of the SDGs. Now we are talking about specific indicators. Suppose the clean fuel for cooking will have impact on the cleaner energy related goal. Then the next slide, we are talking about the literacy among women and men. 82% literacy among women and 90% among women. This is from the NFHS. Census also gives you the estimates for literacy and all, but our 2021 census got delayed because of COVID, and we have to wait for the 2022 or 2023 when the census data comes. And similarly, there is a threshold level of education to be achieved. It should be at least 10 plus years of schooling, and there is some improvement from 54% to 61%, but long way to go. This should become 100. Every woman and every woman and every man should have at least 10 years of schooling. It will have impact on the marriage of the girl and childbearing, and she becoming a mother. She should have school bag in her lap rather than a child till she reaches 20 or 21 years. That should be the motto. That for that, continuation of the education of the girl is very important from that dimension. And then look at the internet use. Very good, indication. 38% for the total Maharashtra and 54% internet use among women in the rural areas. And obviously, men are having higher level of use of internet. But I think internet, mobiles, social media, these are all picking up now. Jamana badal rahi hai. I think the situation is changing. The things are changing. People are changing. So we also have to cope up with that. We have to use the social media. We have to use internet. We have to use WhatsApp. We have to use mobile for communicating to the women about health, about nutrition, about family planning, about age at marriage, all the aspects. Whatever we want to communicate, we can take the help of the social media, internet, WhatsApp, and all, so that we can reach to the people in terms of our communication. Then this is about the mortality rate. Infant mortality rate has reduced very marginally, and it is at the level of 23-24. It should come down drastically. It should be almost below 10 or below 5 or even 0 at the earliest possible. Same is the case with under 5 mortality. Infant mortality rate means the children who are dying before celebrating their first birthday. U5MR means under 5 mortality rate. That means children who are dying before the 5th birthday. This is the description of these two. Another related important aspect is that children who are 12 to 23 months who got fully immunized, BCG, 3 doses of DPT, 3 doses of OPV, and measles vaccine and all. So these are the vaccines that would prevent, that would help the child in preventing various diseases, whether it is tuberculosis or diphtheria or pertussis or tetanus and measles. These are my major child killer diseases. The immunization gives the protection to the child from these diseases. So we are aiming at universalization of the immunization, universal immunization. We want to achieve 100% immunization, but we are close to 70%. And the anemia levels, malnutrition, we looked into that, and these figures are little disturbing. 69% of the children below 6 to 59 years are anemic, and 55% of the non-pregnant women are anemic. 46% of the pregnant women are anemic, and even in case of men, the anemia is low, 22%. The point to be noted is that very high level of anemia even in 2020 in Maharashtra among children 6 to 59 months, women 15 to 49, and non-pregnant as well as pregnant women. These are the indicators that would directly impact your achievement in terms of the nutrition related sustainable development goals. Now we looked into the NFHS figures for Maharashtra. Now let me move to the linkages between population and sustainable development. Are they linked? Is there any linkage between these two? Why should we look into population and sustainable development together? There are numerous links between health and population dynamics. The way population changes, particularly, we have seen that during the COVID time, the migrant population, they suffered a lot because of the COVID. And single migrants, they suffered a lot. Unfortunately, we did not have any data about the migrants. Where are they coming from? Where are they staying? How many of them are staying? what is their living condition, what is their socio-economic condition, what kind of employment they have, and what kind of health problems they have, what is their health status. We did not have any data on them, and we faced a lot of challenges during that time. People migrated from UP, Bihar to places like Bombay and all, and then they suffered a lot. So we should keep the migrant population, their problems, their challenges and all, because it is directly linked to your health status. And the Sustainable Development Agenda acknowledges the link between health and population dynamics. This is a good sign. And what are the issues that need attention when we are talking about population and sustainable development and all? We should provide adequate health care for the elderly people. And on one hand, we have malnutrition problem. On one hand, we have obesity problem. There are children who are overweight because of junk food, lack of physical activity and all. So we have to address that. We also have considerable elderly population. For example, a state like Kerala is having very high level of elderly population aging, and it is likely to increase because the fertility rates are coming down. The elderly population will be more and more in numbers. So we have to take care of their health needs because they will be alone and they have to be taken care of. And we should provide social security, economic security, and physical security as well to them, because the research indicates that there is very high level of abuse of the elderly people in our cities particularly. Similarly, the factors relating to population dynamics will affect, whether it is marriage, whether it is, birth or childbirth or child rearing. All these factors will affect the SDGs and the development goals. For example, the implications of the population growth in terms of environmental challenges, that has to be understood. In terms of global warming or biodiversity or food security, water availability, these are all the issues that need attention, because they all will have impact on the population related factors will have impact on all these factors. And then what is the role of demographers and statisticians when we are talking about population and sustainable development? Whether you study population alone or development alone, or whether you study population and development together, whatever is that, these are the factors that would be relevant for us. Quantification and having measurable indicators to monitor the progress at micro level are crucial, not only at the national level but state level, district level, and even below district level. And the goals have to be smart. Smart means simple, measurable, and they are reasonable and reliable, and they are tangible. You should be able to track the progress over a period of time. And for that, you also need very good and efficient monitoring exercises. And the success of the monitoring exercise would depend greatly on the availability of the data and the capability of the person to use the data, to measure the indicators, to track the progress and report them. So the statisticians, demographers, social scientists have a role here. So you need reliable information about the size, about the growth and distribution and other characteristics of the population. Why do you need this? You need all this information so that, suppose if you say that these are the pockets which are not having access to safe drinking water, you have to tell the government these are the districts, or these are the plots, or these are the tehsils, these are the villages, these are the urban slums, and you have to say that these are the particular population groups that are not having access to drinking water or sanitation, something like that. Then the reaching the unreached, whoever is left out, the government's role is, government is expected to reach those unreached. Governments are expected to take care of the people who are left out from the development process. And our information, which is reliable, will also support the program implementers. And it also helps them to track the progress over a period of time. As I mentioned, population census is a vital source of data for us. It gives information about housing, about drinking water, about migration, about family, about marriage. All aspects are given in the census. It happens every 10 years. The 2021 census got delayed because of COVID, and we are waiting for the census data. And NFHS is another reliable data source, and you have seen the indicators, key indicators from NFHS. But we also need periodic, because census happens only once in 10 years. NFHS also, last NFHS happened during 15-16, then 2021. We don't know when will the next NFHS happen. It may happen during 23-24, like that. So there is some gap. So in between, can we think of some robust study design based research studies to give reliable, high quality data? And we also have, several innovations in terms of communication technologies. And for example, in earlier days, we used to do data collection using the paper and pen. Do the paper and pen, then send the questionnaires to head office, central office, then get the data entry done, then verify the data, and all. It used to take so much time. Even census used to happen like that. NFHS also, earlier rounds used to be like that. But now census will be completely digital. Most of the surveys we carry out, including NFHS and all, they are all digital. So today the team goes to the village, completes the data collection by 5 o'clock in the evening. By 7 o'clock, you will have the data with you. You can see the data, you can track the data, you can check the quality, you can give the feedback to the team to correct the errors that are there in the data. So that kind of advantages are there in terms of technology. And we also have to ensure that the existing data is having open access. Simply by having a report will not help us, because having the report, you can only do cross tabs or read the frequencies and all. But beyond that, you cannot do any analysis. If you want to do multivariate analysis and all, you need micro level data, household level data. For that, everybody should have open access to the existing data, whether it is census or NSS data or NFHS data, whatever data it is there. It should be in the public domain, and it should be available to everybody easily, so that they can use the data and do meaningful research and come out with useful policy and program implications. And the role of demographers, statisticians, social scientists, and development practitioners is crucial in this aspect, because you have looked into the sustainable development goals, and you will appreciate that to achieve the sustainable development goals, we need multi-sectoral approach. To understand the goals, to implement the initiatives to achieve the goals, to track the progress, to understand the achievement levels, to analyze that, and to come out with some strategies to fasten the process to achieve the goals. You need multi-sectoral approach. Statisticians, demographers, sociologists, gender specialists, nutritionists, public health specialists, environmentalists, everybody who is interested in the development of the nation, development of the community, should be joining hands towards this mission. Now, what is the way forward? We need some kind of a mechanism to monitor the progress and identify the unreached and left out with regard to access, choices, and rights, because access, choices, and rights, these are part of the World Population Day theme for 2022. For example, migrants, women, children from the poor families, or vulnerable population groups, children who are on the streets, people living on the pavements, and children, people without any house, they will be wandering from place to place. So look at all these people, good kinds of population groups who are very vulnerable. And accuracy, quality, and timeliness of the data is very, very important. And statisticians, demographers have a role to play here, because this is our area and it is our expertise. So we have to contribute towards that. And then one big research agenda item is linkages between population and sustainable development. Another research area is operations research to test the efficiency of the different strategies that would be implemented. And finally, I am very much interested in our ancient Sanatan literature. And this is from the Brihadaranyaka Upanishad. It says that Sarve bhavantu sukinaha, sarve santu nigamayah, sarve bhadrani pasyantu, ma kaschid dukkha bhat bhavet, shanti shanti shanti. It means may all become happy, may all be free from illness, may all see what is auspicious, may no one suffer. Peace, peace, peace to everybody. I think I am very, very thankful to all of you. And Dhanyavad. I will stop here. Hope I have not taken more time than what you have allotted to me.
Thank you so much, sir. Yeah, thank you so much, sir. So I request participants, if they have any questions, then they can post those questions in the chat box.
Hello.
Yes, sir.
Haji sir, please.
Hello.
Yes, sir, you are
Hello.
audible. You can
Yeah, we are
speak.
able to hear, please.
Yes, sir, we can hear you.
Hello.
Yeah, Suklaji, we are able to hear. Please go ahead.
Yeah. Sir, I want once again the sustainable development course. If you will be explained once again also, we can understand very well. Sustainable development course.
Okay. See, the Sustainable Development Goals, it was the mandate given by the United Nations in 2015. The UN General Assembly has adopted the Sustainable Development Agenda, which has to be achieved by all the countries by 2030. And there are 17 goals as part of that, starting with poverty, then hunger, then various targets are there about education, about inequalities and all. And the idea is that if all the countries across the world and are able to achieve these sustainable development goals, 17 goals that are part of the Sustainable Development Agenda, the whole world will become, a livable world. And not only that, it will become sustainable. Sustainable means it is like this: our future generations will not suffer because of some inactions of us today. So we will be, we all think that for our children, we should give them some property. We think that we should give them some bank balance. We should give them, some assets and all. We think about that. And the Sustainable Development Agenda is about giving very livable planet, very comfortable, livable planet to our future generations. That is as simple as that. Whereas, if I want to give a house to my daughter, if I want to give some property to my daughter, I will do efforts on my own. Whereas this is for the society as a whole, for the future generations as a whole. So each one of us has to contribute. Each one of us has to say that, oh, my son has to live here, my grandson has to live here, my granddaughter has to live here. So it is my responsibility to keep him or her happy, to keep him or her comfortable, and he or she should not suffer in terms of pollution, in terms of global warming, in terms of hunger, in terms of poverty. I don't want my children to be poor. I don't want my grandchildren to be poor. I don't want my grandchildren to suffer with extreme temperatures. I don't want to have my children suffering because of disasters and climate change and all. That is the idea. And it has about 17 goals and about 161 targets are there, and NITI Aayog is monitoring that progress that we are making as a country, and their reports are there available on the Niti Aayog's website and all. Hope I have answered you, sir.
Any more questions? Participants, if you have any more questions, please.
Yeah, there is a question about the operations research. Yeah, very good question. Jayed Mohammed, very good question. Operations research means, see, we have OR in statistics also, but in the applied research, operations research means we carry out a research study before the strategy is implemented. Before the strategy is implemented, and then we will do monitoring of the strategy. Suppose if the idea is to improve the performance of a school in a rural setting, then we will give some specific inputs to that school, and we will not give the inputs to different school which is nearby, and we will implement the operation strategy or strategy for a period of about 6 months or 1 year, 3 months or 6 months or 1 year. Then during this implementation period, we will do some small scale follow-up research activities, and we will do the baseline survey. We will do the end line survey after the implementation of the strategy. Then we will assess the impact of the strategy, whether the strategy that was implemented is giving us the results or not giving us the results. If you can implement many strategies like that and see which strategy is giving you better results, which strategy is more effective to help you in achieving the goals. So that is in a nutshell about the operations research.
Another question by Brajesh sir. Sir, can we change family planning problem into a linear programming problem? Is it possible?
Yeah, I think the Brajesh, good question. In fact, in 1952, India was the first country to adopt family planning program officially. And unfortunately, sorry to say this, 1952 to 2022, we have not made such progress. Whereas some of the other countries like Indonesia and all that have started their family planning programs much later on the based on India's program, they have made good progress. There were several reasons for that, and I don't want to get into that. So the idea is that initially it was family planning program. Later on, it became family welfare program. Then it became child survival safe motherhood program, CSSM program. Then it became reproductive and child health program. Like that, the name and the nomenclature was also changing over a period of time. But fact is that we have to address the reasons for low acceptance of family planning, lower levels of contraception, and some of the research studies indicate that the high levels of infant mortality, child mortality, low levels of education, early marriage, several reasons are coming into picture. The woman's ability to make a decision and the woman's ability to convince the spouse as well as the in-laws in accepting small family. We also have the son preference. Like that, several reasons are there. So I think another important aspect is that the socio-cultural, economic factors and situation changes in our country from state to state. The situation in UP is completely different compared to a state like Kerala. Even in UP, Eastern UP is different, Western UP is different. There are differences. Same is the case with many states. So there are, if you go to northeastern states, the situation changes from district to district. So my point is that my experience tells me that we should have, district specific strategies sometimes that will give you better results rather than one strategy for the country as a whole. in a country like India where there are changes and challenges and threats in the way sustainable development crop up, global competition. Piyush Ranjan, can you read out that? I am not able to read.
Sir is saying that in a country like India, where there are challenges and threats in the way of sustainable development, what institutions, that is, rules and regulations should be formed by the government? So, what rules and regulations should government form in such countries?
Yeah, I think Piyush, you have a good question, and you are talking about the challenges and threats. Yes, there are challenges and threats on the way to sustainable development, and the global competition is also there. And we have seen it during the COVID time. About some of the countries, I don't want to name them, the way they were playing with the government of India in terms of vaccine and all. And but the government was able to do that. And I think the global rules and regulations, the global competition, these are all part of the WTO, World Trade Agreements and World Trade Organization, that agreements and all. I think recently there was a statement from some Minister Piyush Goyal, the Commerce Minister, about these trade agreements and that what kind of stand Indian government is taking there and all. That is from the global perspective. Coming to the national level and local level competitions and all, I think the government is aware of that. We have a national competition commission at the union government level, and their role is to address these kind of challenges and all at the national level as well as the state level. I think there is a mechanism to address these kind of issues. You are right.
Thank you, sir. Any more questions? Participants, if you have any questions, you can even unmute yourself and
Yeah.
ask.
Yes, sir. Hello.
Yes, sir, you are audible.
Yeah, ma'am. I have one more question about digital activity advantage used in NFHS survey.
Yeah, Sutraji, where are you from? Which institution you are?
I am from RDI.
RDA, okay.
Yes, sir.
I think RDA was part of the NFHS, I am correct.
Yes.
Yeah, I think let me not just talk about NFHS only. Let me talk about generally the advantage of use of digital platform for collecting
Yes, sir.
data. As I mentioned, I started my research career in way back in 1990.
Yes, sir.
And for almost 2 decades, we were using only paper and pen based questionnaires and all.
Yeah.
If I can give you example, sometimes we used to do suppose the fieldwork happened somewhere in Assam. The questionnaires were coming from that district in Nagaland to Guwahati. In between, there was some road blockade, there was some flood, something like that, and we lost the questionnaire. And so we lost the data for that PSU or for those number of PSUs and all. That kind of problems were there. And sometimes the courier, got misplaced. The
Yes,
courier
sir.
went somewhere else and the courier was not delivered. So we lost the questionnaire. That kind of, loss was there. Whereas now, because of thanks to the technology, there are challenges in technology also. If you don't save it properly and if you don't give unique ID properly, then you will also have challenges in the digital platform also. But advantage is that you are real-time data. You are getting the data on the same day on your desk. You can review the data, you can give the feedback to the people so that the quality of the data can be enhanced. And not only that, you can also ensure that your funding agencies and your technical experts, they also get the benefit of the data. And by having this kind of access, they also can give their inputs, they also can share their feedback. Ultimate idea is to ensure that the quality of the data is obviously our intentions have to be correct. If our intentions are correct, all these tools will also provide the enabling environment. And if there are some issues within our intentions, then no one can save us. Even God cannot help us. Yeah. Another question,
Yeah.
data quality.
Okay, thank you very much, sir.
Then data quality is more important to formulate any policy or launch any program. How can we improve the data quality in any survey, census? Yeah, I think, data quality is very important. If you suggest, Dr. Vijay, we can have one separate session on data quality, because data quality is an ocean and there are so many dimensions in the data quality. Data quality attention should start from the questionnaire designing stage. Data quality depends on the questionnaire, the terminology used in the questionnaire, user friendliness, field friendliness of the questionnaire. And we prepare the questionnaire sitting in AC rooms and thinking that somebody in Delhi metropolitan or Bombay or or Bangalore will answer. No, some people who are living in remote villages who do not even wear proper clothes, the tribal community, they will be your respondents. We never think about them while framing the questions. And sometimes, I am not talking about any particular study, but by and large, I have seen some clients, who are, influenced by US. We come across multi-country studies. They say that, we are using this question in US, Cambodia, Nigeria, Netherlands, we in India. And they use the same culture, same, kind of language in India. I tell them that no, what's in US will not work in India. In US, you can ask any question to anybody in any situation. In India, you cannot ask like that. The cultural situations are different. So you have to keep all these things in mind. That was one. Another thing is interview duration. Honestly speaking, if any interview that, Professor KB Patel, our former director of IAPS, used to say in our seminars that any questionnaire should not have more than 40 questions and should not take more than 30 minutes. Whereas in many studies, we are asking question, and the interview time is 2 hours, 2.5 hours and all. I am sure the data quality will suffer because of the length of the questionnaire, the length of the duration of the interview. Longer duration of the interview will have more data quality related issues. And during the training, we have to give emphasis to the quality aspects, and special training has to be given for that. And we should carry out spot checks, back checks, accompanied interviews and all. Some of the surveys, they are not doing back checks. If you don't do back check, then you don't know whether the interview was done or not. So these are all the different, and feedback, timely feedback to the team and course corrective measures. Sometimes you may have to retrain the teams. Sometimes you have to drop some of the interviewers who are not improving their performance. Like that, several measures are there. Yeah. Any other point?
I think there is one more question. Which kind of paradigm shift do you think is the process of sustainable development in new normal?
What kind of paradigm shift one could expect?
What kind of paradigm shift do you think in the process of sustainable development is in the new normal?
See, the paradigm shift is that for the first time, the population dynamics has come onto the limelight. And because of the linkages between population dynamics and sustainable development, there is enough attention paid by everybody at every level across to the population dynamics related issues. Number one. Number two, earlier days, even we had Millennium Development Goals, and we could not achieve the Millennium Development Goals because there were some lacunae in the Millennium Development Goals, and the Sustainable Development Agenda was prepared by learning lessons from the Millennium Development Goals and the efforts made and the achievements that were there as part of the as a result of the efforts. So that kind of advantage was there for the Sustainable Development Agenda, agenda preparation stage for the people who are involved in that. That was one major shift. And another beauty is that, there is constant review of the progress made. That was another important dimension for the sustainable development agenda. And the goals are clear, and the set of targets that are to be used for assessing the progress of the sustainable development goals is also, I think, well thought out. And I think these are all the, kind of shifts one can see in the initial stage, at the implementation stage, and during the during the tracking stage for the sustainable development agenda in a nutshell.
Thank you so much, sir. I think, are there any more questions? Participants, if you have any questions, you can unmute yourself and ask. Okay, so I think there are no more questions. So now I would like to invite our head of the Department of Statistics, Professor Dr. Asha Jindal ma'am, to propose the formal vote of thanks. Over to you, Asha ma'am.
Thank you, Pratiksha. I hope I'm audible to everyone.
Yes, ma'am, you're
Yes,
audible.
ma'am, you're audible.
A very good evening to our most valued and worthy keynote speaker, management committee, respected teachers and beloved friends. It's a matter of pride for me that I'm proposing a vote of thanks for this webinar. I, on behalf of Department of Statistics, want to express sincere thanks to our keynote speaker, Dr. Somaya Julu, who gave his vital time from his busy schedule to grace this webinar and sharing with us graceful opinion on World Population Day. Further, a big thanks to Dr. Hemlata Bagla, Vice Chancellor and Principal of KC College, HNC University, for her constant support and encouragement in all the departmental activities. I would like to place my heartful thanks to Dr. Shalini Sinha, Shalini Sinha for making all cooperation in our departmental activity and this meeting. I would like to place my hearty thanks to all the volunteers and participants because of whom we made this meeting possible. I'm fortunate to thank the dedicated and well-motivated team of my department who is aware of their task and are very concerned about the results. If I forgot to give thanks to anyone and everyone for their participation and mobility to make on the accomplishment of this meeting work. Thank you very much, each and every one of you.
Thanks to all of you. Thank you.
Thank you so much, sir. Ma'am, with sir's permission and your permission, shall we end the meeting?
Yes.
Thank you, sir. Thank you, ma'am. Thank you all. Thanks for joining.